Hello Mike, this is Christian. I'm just letting you know about the presentation that I'm going to be giving on May 9th at the staff meeting. I will be emailing you a more complete overview of the project. So this particular presentation is going to just cover the reason, basis, some information behind, and hopefully foster some motivation in the subject so that we can have a group meeting after this and determine the specifics. Although I think it's going to be something along what we thought of, be it a health stream or training, to get people to pick up better habits for promoting sleep, and then having the patients review at the end of the night the quality from 1 to 10, and recording that in PowerChart and then pulling that information out at the end for statistics. So in this presentation, we'll start with this opening slide. I'll be introducing myself, even though everyone will already know me. And we'll be doing improving sleep in the intensive care unit. Now, as we know that sleep is an issue, there is a billion factors why we can't sleep in an ICU setting. And the only reason why we do is because we know that we need it. And just to start off with some interesting facts, it was supposedly 60 nights of not sleeping, not having proper sleep because of the use of propofol that led to his death. 15 hours is the number Mariah Carey claims she needs to sleep to perform. A 15-minute power nap claimed by Leonardo da Vinci. He just slept for 15 minutes every 4 hours, so he could do something crazy. 7 days is the length of time John Lennon and Yoko Ono spent in a Montreal bed as part of a sleep-in thing, and 11 days is the longest recorded time without sleep. And it said that most people can survive up to 2 months without eating, but people could only survive up to 11 days without sleep. So some of the dangers of sleep, and these are presented in a fashion that's for everyday people, not specifically to the ICU. But if you notice that a lot of these things do relate to a lot of the things that we have to deal with. Higher anxiety levels, increase, lower acceptance of meds, stress, and having to deal with higher anxiety patients is absolutely horrible. Impaired cognition and functionality. They're not really able to understand the things that are going on around them. Depression obviously leads to much higher chemical levels that are in the body and less adherence to the medications that we're giving them, and higher risk of hypertension. As we know, we do not want hypertension unless we're unless we're on way too much levo, and then we can maybe just try and starve them to sleep and build up their pressure. So more scientifically, day 1, focusing eyes, moodiness, and day 2, difficulty focusing eyes, day 3, irritability, memory lapses, and then when you have 3 days of not sleeping is the first signs of hallucinations. Day 4, hallucinations and recognitions that are not real. Day 5, paranoia. As you can tell, this is our delirium. So after 5 days, we are seeing patients that will start to develop symptoms of delirium. Here I have what's basically a healthy sleep cycle, just to understand it a little bit better, and I'm sure most of the people here do, that sleep isn't necessarily just one solid thing. You go through stages of sleep, including S1, S2, S3, S4, and then REM. So essentially S1 and S2 are nothing sleeps. They are shown by these brainwave patterns that are very similar to that of us being awake, and then the brainwaves become longer and have a greater amplitude, and this is when we're known to get most of the substance of our sleep. There's little bits of dreaming, but majority of the dreaming, and then supposedly the mental refreshing comes from REM sleep. So if a person claims that they have dreamt, then they claim that they are in REM. And the first cycle they have, it's the biggest one, and then cycle 2, 3, 4, 5 throughout the rest of the night will be subsequent. So hopefully we can get them to have one big cycle. It doesn't necessarily have to be at the beginning of the night, but we can get them to get at least one cycle of sleep, and then hopefully maybe a few more mini cycles. If you look at this is characteristics of people in ICU on top, and then a regular person on the bottom. As you can see, the ICU barely gets any sleep whatsoever. And what it is, it's fragmented and not that deep most of the time. So try to get some rest. I'll be in every few minutes to make sure that you don't. Some of the things that come into it is baseline sleep insufficiency, medical disorders, pain, environmental factors, staff-patient interactions, mechanical ventilations, medications, and medication withdrawal. So here we have a look at some of the things that we're dealing with. Now this was going to be originally a project on delirium. We decided to focus on sleep deprivation, and if you look, you can see that a lot of these things feed into each other. The ABCDE bundle is a commonly used anti-delirium protocol. If you notice and you look at it, is extensive how I'm doing it. So we're trying to pull out a simple aspect of it, something that we can focus on, something that we can work on and improve on, and that we can show the most results. Now, what we can do is we can get little naps. Now, our goal here will be this will be this 90 minutes here. If we can get the 90 minutes here, then that will be absolutely fantastic. If we can get 60 minutes, this is when we get a nap. You get some grogginess out of it, but you get some slow waves. 30 minutes, you get a little bit of restorative benefits, and then the 10-20 minutes, you actually do get some benefits, but it's not particularly much, and it'll only be a supplement to hopefully what we'll be doing. And again, improving sleep in the ICU is our goal. And this is by me, Christian Berg. If you have any other questions or would like to talk to me more about it, please feel free to email me or come up and talk to me whenever. I am more than happy to talk to everybody about this. So, Mike, this is my presentation in short. I'm going to improve upon it a little bit more and maybe go over a few of the things. But I will contact you, and feel free to contact me in the next available chance.